as a Fox News contributor, surgeon, and a professor of health policy at Hopkins, and author of The Price We Pay. Am I wrong to think that we are turning the corner in many states on this variant?
We are, Brian. We're in a good spot where the numbers are showing a steep decline. There's still some parts of the country where the virus is still peaking and the hospitals are going to be strained. But the hospitals are not necessarily strained from the influx of patients alone. We normally have a massive influx of patients every winter from a number of respiratory pathogens. Sometimes it's a bad flu season. The difference is this time we've got a massive staffing shortage. 1 in 5 workers in healthcare have left. And if you look at what happened at Washington State, they fired 55 workers from this hospital system called Multicare. And then they were so short-staffed, they told people who tested positive, who were working, even if you have COVID, come back into work. Even if you have symptoms, we are that short-staffed. That's the problem with the staffing crisis that people don't know about.
So you are saying, let's reinstate the workers fired under the vax mandate because the new data shows natural immunity has equal to, if not better, immunity than the vaccine. We saw how the vaccine was so, inadequate when it came to this variant to begin with. Along with boosters, we're seeing all these double vaxxed booster people suffering and getting this variant. So you're saying unfire them, bring them back. You need them.
It's time to reinstate American workers who were fired under the vaccine mandate for a number of reasons. Number one, it was unfair. Number two, we have therapeutics now that really mean no one should be dying of COVID. And number three, it turns out many of them had natural immunity. And when when employers fired workers with natural immunity, they got rid of the workers least likely to spread the infection. That's the great irony. The data are now in. It's clear. The CDC itself has a study. And Johns Hopkins, as you know, my team has been doing a big study on natural immunity. And we just got the early results, which I put in today's Wall Street Journal piece.
So what more can you tell us about the editorial that has not come out yet and from the study that you guys conducted?
Well, one of the arguments that public health officials have used to discount natural immunity, and we're one of the only countries that blows it off, is they say we don't know how long it lasts. Well, the NIH has $42 billion. Why don't you just study it? You could do the study with about 100 people. You just invite them in who were infected in New York 2 years ago and test their blood. So we did that study, and we looked at 295 people with natural immunity. They were not vaccinated, and we found that the immunity was strong nearly 2 years out from the infection. So it is now a settled science. Natural immunity is durable and effective for as long as the infection's been around.
Did it vary person to person? Did it vary on the size and gender of the person?
99% of these subjects we studied had antibody levels that were almost as effective and consistent as they had in the early time of their recovery. And there was some small variation, but we're talking within 1% of that sample.
Pretty amazing. I mean, because I know people that got it, had the natural immunity, and they had tested their antibodies, and they seem to have faded, but you didn't find that.
It turns out that there's a low level of exposure that we think people have. So even once you've recovered from COVID, there's sort of almost a low-level stimulation of that immune system because it's everywhere. And certainly with Omicron, we know it is everywhere. Even public health officials now are finally admitting everyone's going to get it.